Hey friends, today we're talking about cardiac assessment. And before we start, I need everyone to know that when I first learned this, I was convinced nursing instructors were making things up. Because I'd put my stethoscope on a patient's chest and hear lub dub, and I had no idea if it was normal or a murmur, or just the soundtrack to my own anxiety. So if you're feeling overwhelmed, you're in good company. Let's break it down. The heart is a pump. That's it. Everything we assess comes down to one question. Is this pump moving blood effectively? Every sound we hear, every pulse we feel, we're basically detectives trying to figure out if the pump is doing pump things. Now let's get the thing everybody hates out of the way, the landmarks. First thing to know, these are not where the valves live. These are where we listen to them. Don't go crazy imagining valves sitting directly under your stethoscope. Here's the sequence. Aortic at right, second intercostal, pulmonic at left second, and Erb's point at left third. Then tricuspid at left fifth, and mitral at left fifth at the midclavicular line. And honestly, the cheat code is 22355. If you can remember that, you're already ahead of where I was. Now let's talk about the famous lub dub. Everybody knows the sound, but most people don't know what it means. S1 is the lub. It occurs when the mitral and tricuspid valves close. The ventricles are clocking in for work. S2 is the dub. It occurs when the aortic and pulmonic valves close. Okay, everybody, work is done. Time to relax. That's one complete cardiac cycle. Lub, dub, pump, relax, repeat. This is where nursing school starts getting spicy, because apparently 2 heart sounds weren't enough. We need bonus sounds. S3 occurs after S2. It sounds like lub dub, hey, I'm back. I picture someone pouring too much water into a cup, sloshing. S4 happens before S1. I imagine the ventricle throwing a tantrum. It's stiff and hates being filled. Lub, dub. This question is everywhere. High-pitched sounds, use the diaphragm. Low-pitched sounds, use the bell. That's it. S3, S4, and murmurs, use the bell. And please don't mash it into the chest or you're turning it into a diaphragm anyway. A murmur is turbulent flow through heart valves. A bruits is turbulent flow through an artery. But how do they sound? The trick. Swooshing starts with S, S1, S2, S3, S4 are all S words. Therefore, swooshing belongs to the heart. Murmur. Whooshing? Not an S word. So it's a brew-wee in an artery. Is it scientific? No. Will you remember it? Absolutely. Here's the easiest way to remember. Left and lung both start with L. Right and body? Think, getting my body right. So, left pump failure means wet lungs. Right pump failure means wet body. Let's practice. A patient has bilateral leg swelling, JVD, and rapid weight gain. Which side is failing? Don't cheat. The answer is right-sided heart failure. Remember, wet body. That means symptoms like leg edema, jugular vein distension, and rapid weight gain. If this feels overwhelming, just ask, is the pump doing pump things? I'll see you in the next video.